Today, we are going to go over how to safely transfer a person requiring moderate assistance from the bed to a wheelchair and back following a total hip arthroplasty. By performing this task correctly, you will ensure the safety of both the patient and yourself and protect the post-surgical hip. You should consult your physician or other healthcare professional before performing these tasks or skills to determine if you are able to perform this level of activity safely. This is particularly true if you or your family have a history of high blood pressure or heart disease, or if you have ever experienced chest pain when exercising or have experienced chest pain in the past month when not engaged in physical activity, smoke, have high cholesterol, are obese, or have joint problems that could be made worse by a change in physical activity. If you experience faintness, dizziness, pain, or shortness of breath at any time while performing these tasks or skills, you should stop immediately. Stop immediately if anything causes you pain. Before we get started on the transfer, let's talk about hip precautions. These are movement restrictions the patient needs to follow to protect the operated limb and surgical site while the body heals. In this video, we are going to go over a posterior approach total hip arthroplasty, which is more common. However, make sure you know what technique the surgeon used on your patient because the patient's precautions will differ depending on the approach used. For a posterior approach total hip arthroplasty, the patient should avoid flexing the hip past 90 degrees, internally rotating the hip past neutral, and adducting the hip past neutral. This means that transferring the patient becomes more challenging, but we are going to show you how to perform this task safely and effectively. Always make sure your environment is clear and you have adequate space to maneuver before starting the transfer. This prevents you from needing to stop halfway through a transfer to move something out of the way, ensures there are no potential tripping hazards, and allows you to avoid potential awkward positions for yourself where you cannot maintain good body mechanics. Always make sure the patient has shoes and socks on before having them stand up. Our patient for this video requires moderate assistance, meaning they can perform at least half, but less than 75% of the work themselves. Make sure you raise the bed up for these patients to make it easier for the patient to stand up without breaking their hip precautions. Finally, although the patient has movement restrictions, unless otherwise indicated, these patients may put as much weight as they are comfortable with on their surgical limb. Now let's get started with the transfer.
Hello, how are you doing today?
I'm good. How are you?
I'm good. My name is Jordan. Do you mind if I work with you?
Yeah.
Alright, perfect. So, our patient here had hip surgery, and so there are a couple things that she can and can't do, and one of those things is bringing her toes in, crossing her legs, or bringing her knees past 90 degrees or her hip. So can you go ahead and explain that back to me?
I can't turn my toes in, I can't cross my legs, and I can't bring my knee past my hip.
Jordan asked the patient to repeat these precautions to ensure they understand and will remember their movement restrictions. Next, notice how he explains the task to the patient so they know what they're doing.
So we're going to go ahead and get started. We're going to get you from laying down, and we're going to get you into this wheelchair over here. You ready? Now that we've gone over precautions with her, we need to prepare the area for the transfer. So what we're going to do first is we're going to bring over a wheelchair. This wheelchair needs to have some type of foam or wedge inside of it so she doesn't break the knees above hips precaution. So we're going to set that down. We're going to bring this here. Make sure you leave a little space for you so whenever she starts to turn towards the wheelchair, you don't get squeezed out. Off the brakes. Come over here. Get your walker. We're just going to set that over here. Next, we're going to take away the pillow. Perfect. Now we can start the transfer. We'll put the gait belt on when we get the patient up to where we can reach around her. But before we do that, we need to make sure we don't hit any contraindications, and such of that would be abdominal surgery, tubes, lines, or anything coming from the abdominal area that would be impeded by this. Alright, so are you ready?
The first part of the transfer is having the patient pivot so their legs are over the side of the bed. Have the patient prop themselves on their elbows or hands, whichever is more comfortable for them. Have them bend their uninvolved legs so their foot is on the bed. Then carefully pick up their involved limb and ask them to pivot to the side you want them to transfer. They should use their arms and uninvolved leg while you guide their involved leg. Keep their hip externally rotated and abducted throughout the movement. Next, have them prop themselves up with their hands behind them so they maintain a backwards lean and keep their hip angle open. Then have them scoot forward and place their uninvolved leg on the floor while you guide their involved leg. Now go and give this part a try. It may seem awkward at first, but with practice it will be second nature. Great job! Now let's move to the next part. At this point, you should put a gait belt on the patient, making sure it's snug so you can only fit a few fingers through the belt. If the patient has contraindications for wearing the belt around their abdomen, you may simply place it higher up. Before standing the patient up, make sure their walker is in a good position for them to place their hands on it once they are standing. Always stand on the involved side of the patient. This allows you to block their affected leg from collapsing when they stand up, and if the patient were to fall to that side, you are right there to catch them. Placing a hand on their gait belt also gives you a good way to prevent them from losing their balance and allows you to give them some assistance when they stand up. When you are ready for the patient to stand up, have them place their feet underneath them and instruct them to push through their legs on the count of 3. Make sure you use proper lifting mechanics. Although Taylor was able to stand up without using her arms, if your patient needs an extra boost, make sure their hands are on the bed, not the walker, because the walker is not sturdy enough to support their weight while standing up. Many of your patients will try to use the walker, and you should stress to them that it is not safe to stand up this way. Once the patient is standing up, ask them if they're feeling okay. You want to make sure they aren't lightheaded or dizzy before going any further. Go ahead and try out this sit-to-stand. Practice it with people of different sizes and requiring different amounts of help so you will feel comfortable with any patient. Now you're ready to help the patient move into the chair. Instruct the patient to take small steps to maneuver themselves so they are facing away from the chair. Make sure they are keeping the toes of their surgical leg pointed out so they don't break their precautions. Move with your patient, keeping a hand on their gait belt and another on the walker to help guide them into the correct position. Next, have them back up until they feel the seat of the chair against the back of their legs. Then instruct them to place their hands on the seat rests and slowly lower themselves into the chair. Make sure they are in a good position with their butt against the back of the seat, and you can unlock the brakes and move them where they need to go. Practice having the patient move from the bed and into the wheelchair. This part may seem easy, but you can run into problems if you haven't left yourself enough space. Once you've got this part down, you're ready to put the whole thing together. And remember to take your time with it and go at a pace you are comfortable with. Now the patient is ready to get back into bed. All you need to do now is reverse the process. Put the wheelchair in a good position and remember to lock the brakes. Make sure the bed is raised up a little so it's easy for the patient to lower themselves down into the bed. Place the walker in front of the patient, then have the patient place their hands on their armrests and scoot towards the edge of the seat. Have them place their feet on the floor underneath them, and remember not to let your patient lean forward so they don't break their hip precautions. Make sure you are in a good position with a hand on the patient's gait belt and have them push through their arms and legs to stand up. Since the wheelchair is lowered down, they will likely need more help standing than they did getting up from the bed. Turn the patient so the back of their legs are against the side of the bed, the same way we did when moving the patient into the chair. Remember to have them take small steps and keep their toes pointed out the whole time. Now have the patient put a hand on the bed and slowly lower themselves down onto the bed. By keeping your hand on the patient's gait belt, you can control their descent. Have the patient place their arms behind them so they can lean back and keep their hips from flexing too much. Now that the patient is seated, you can remove the gait belt and move the walker away from the bed to make sure it doesn't get in the way. Then support the patient's affected leg with your arm and raise it up and across the bed while the patient simultaneously leans further back and pivots into bed. Move with the patient at a pace they are comfortable with. You may need to go slowly with this part. Once the patient is back in bed, you can remove their shoes and socks. Place their pillow or wedge between their legs and get them comfortable in the bed. Always lower the patient's bed and leave them with a call bell where they can reach it before leaving the room. Give this part a try. Practice going from either side of the bed so you can get the hang of this transfer. Fantastic. Now we'll show you another method you can use to get the patient back in bed from a sitting position. Have the patient slowly lower themselves onto their side while you support their leg, keeping it from breaking midline. Once they're on their side, have them roll to supine while you support their leg and prevent their hip from moving into adduction or internal rotation. If you're shorter, it may be necessary to shift positions to the foot of the bed once you have the patient sidelined. Note that for this transfer to work, the affected leg must be closer to the foot of the bed when the patient isn't sitting. In this version of the transfer, Jordan will instruct Taylor to roll onto her side. He helps her move into side lying by supporting her affected limb, keeping it abducted and externally rotated. If necessary, he could assist rolling at her upper body with a hand on her scapula. Once Taylor is on her side, he instructs her to push through her arms and helps move her into a sitting position. Notice that while her unaffected hip is flexed to make the transfer to sitting easier, her affected hip remains in a more extended position. From this point on, the transfer is the same as before. Practice both methods, see which one you like better. We hope you enjoyed this video and found it educational. Thank you for watching.